and on hepatitis and other viral and bacterial and fungal infection as well. And so that is what we are doing. This is really our vision, to be at the forefront of clinical science that improve prevention, diagnosis, and treatment of infection in children, and really to build a global network we can address scientific questions, but not just scientific questions, but really to contribute to the access and to drug and the implementation of the evidence related to this drug. As I said, we do have several scientific areas and scientific priorities. HIV infection is, of course, our history, and other, but also other viral infection. We are focusing on severe bacterial infection, neonatal sepsis. We have been running several large randomized controlled trials in neonatal sepsis in Africa, funded by the European Commission. Most of our funding comes from the European Commission and AMR. Then we are focused on infection in pregnancies and vertical transmission. We are running a program in Europe, but also outside of Europe, on RSV infection, on prevention of RSV infection. And in 2015, 2016, we had a large program on prevention of Zika infection in Latin America, again funded by the European Commission. Then we are also very much involved in the preparedness, which is really establishing platform and programs to tackle infection with the pandemic potentials, and we are on the forefront for the pediatric part and the pregnancy part in this area. And we have been so far mainly focusing for Europe, but now we are really, and that we've already been discussing with quite a few of you who are part of the Penta clinical trial network or of the Penta network. We are really now planning really to expand and to build a pandemic preparedness platform focusing on children and pregnant women in Africa as well. So this is, we had a lot of clinical studies, more than 50. We have been enrolling more than 50,000 women and children. We have a network of more than 100 sites in more than 30 countries. And of course, we are, as I said, we are really planning ahead, because we think that science is, let's say, not as meaningful as it should be if we do not also think about access and delivery of the drug, which is not really our primary responsibility, but is for sure, as an advocacy organization and a research organization, we are partnering with a lot of different organizations, and we are so pleased to partner